Hello, this is your Louisiana chiropractor, Dr. Eric Prather, coming to you from Lafayette, Louisiana at Prather Chiropractic Services. Today, Megan's going to be getting your weekly
ring dinger.
Yeah.
So excited.
Weekly ring dinger. We try to practice what we preach here and get ourselves adjusted as well for all the recommendations we make with patients about trying to keep their spine in good working order, doing maintenance, getting adjusted on a regular basis, practicing prevention, living a healthy lifestyle. You know, it's important for us, the caregivers, to take care of ourselves so we can be in good shape, taking care of other people.
Exactly.
They're counting on us, and we need to be in good working order for that reason.
I gotta be in shape too.
That's right. You got any complaints today, Megan?
I do. In my neck, I always have this little aching right here, and it's bad today. So
Working
right
on the
in here.
computer,
Yes,
billing
that
insurance,
over like
being on the
all
phone.
day.
Yeah,
Right.
it takes its toll.
Yeah, absolutely.
That results with, in addition to gravity pulling on us and pulling us forward, we get what's called a head forward posture, where the head starts to go into forward flexion.
And I find myself doing that quite often.
The shoulders start to curl forward. The musculature in the front of the neck and the chest start to shorten, creates tension in the back of the shoulders, leads to headaches, leads to numbness and tingling going down the arms, degeneration in the neck. So yeah, we just got to undo what work ergonomics and gravity is doing to us hours on end. We got to undo that with an adjustment. Try to pose it.
Ready.
So anything else? That's it?
That's about it. Yeah.
All right, well, we're gonna start out with the decompression, okay? Come right over here, sit on the table. Okay, there we go. Get that pelvis lined up, okay? Let the leg relax. We're gonna put the spine in a relaxed position. The weekend ring dinger. Last patient of the day.
That's it. Got to get me ready for the weekend.
All right. A little bit higher. All right, good spot there. Those pins nice and snug, right and tight.
Right and tight. It's like I'm right in the middle of the two.
There you go. That's it. You're right in the middle. That's correct. Okay, back teeth touching. Breathing through the nose. Wiggle your third toe. Breathe, breathe, breathe.
Man, I felt that all the way down.
Good. It was a good follow through. Still kicking. Say like Dr. J. Let it settle. We good?
I'm good.
That cervical break. Crack addicts gonna love Megan, that's for sure. All right. Superwoman onto the table, please. Okay. Let's check that leg length. It's dead even. Dead even after the ring dinger. All right, we're going to start by working in the sacrum. Release the pelvis, lumbars, thoracics up into the cervicals, okay? L5, 4, 3, 2, big release. Big release. All right, Megan, there we go. Cervicals. Okay, roll it on over for me. There we go. Hands over the tummy. We're going to adjust the head back over the shoulders. Remember, we want to correct that head forward posture. Okay, now.
This is my favorite part.
Yeah. It's a lot of people get a lot of relief when we start to work on those glenohumeral joints.
It feels so good.
Rib cage, decompress that? Right. Good. Not too much pressure trapped in there. Yet another maneuver we can do to release the pressure in the, look at that, the glenohumeral joint. That's where you hold your tension. I mean, your pattern is definitely in your shoulders. There we go. A little apprehensive about that adjustment. Huh?
I am. Always with the arms.
Yeah.
I don't know why.
No, it's the rec, prior rec.
Yeah.
All right, good release. Okay. Let's check in the chair here. We'll make sure that atlas is where it needs to be. C1, C2. Okay, we're checking the movement of the upper cervical complex. The atlas will deviate lateral, either left or right. So when we feel that, she's got a little bit of restriction on this right side. So we're gonna get that with a Gonstead adjustment. Chin up for me, let that hip really let go. Okay, good, good release there. Now we're gonna drop down, hit that C2. Good release there. All right, you good?
I'm good. That was
Done.
awesome.
All right, you got any questions for me?
What do I do if I'm a little sore? What should I do?
Ice and
Ice?
stretch.
Okay.
Yeah. Some people do the hot shower, with the heat, the moist heat.
Right.
I don't recommend that. Even though it feels good while you're doing it, what
Right.
can end up happening is you increase inflammation
Right.
by putting heat on something that's sore or inflamed already. So ice and gentle stretches are the best thing. Best technique for icing, you take a Ziploc bag, put some crushed ice in it, apply it to the sore spot. You can do that for 20 to 30 minutes, take it off for an hour.
Awesome.
Okay.
Thank you.
Very good. All right, this is your Louisiana chiropractor, Dr. Eric Prather. We'll see you soon.